Are there plans for the government to look into the options of bereavement bubbles?
The answer is that the rules around social contact for people who are bereaved need to take into account individual circumstance. And I've been clear about how we, for instance, changed the rules around funerals to allow a more liberal approach to people going to funerals because it's such a critical moment. The rules are clear that where there are exceptional circumstances, then people may be able to act differently. This is true, for instance, around childcare as well. Having a set of having people behave in a reasonable and sensible manner around being able to support each other through bereavement, for instance, is incredibly important. Now, none of these things are really straightforward because the nature of social distancing rules are that there are an awful lot of exceptional circumstances that you have to take into account. What really matters when it comes to social distancing is that people follow social distancing where that is necessary, especially around social events, in order for us to be able to act as a society with compassion when people need that extra support in exactly the sort of way you described.
Secretary of State, thank you for that answer. We've heard consistently evidence to this committee that during the pandemic, countries that have perhaps fared better than us have had very consistent, very clear communication, and that communication has been an issue throughout this crisis. And I think it's very difficult to communicate why it is that somebody might be able to go to the pub with a group of people but not be able to be there with a loved one when they are grieving or perhaps going through a very stressful period of their life, such as going to routine maternity services. I really must stress that there's the ambiguity that you've just given in your answer, I think, demonstrates the problem. And I've got my last question because I know there are others due to come in. Over 900 healthcare workers have died during this pandemic. Do you plan to meet with the families of NHS and social care workers who have lost their lives during this pandemic?
Yes, of course. I'm very happy to meet with and have done.